common myth that we hear from patients who are initially seeking a consultation is that they're concerned that they won't be able to eat, that they'll be living off of supplements or off of protein shakes. And that's also an understandable concern, but fortunately that is absolutely not the goal. The goal after bariatric surgery is to rebuild the diet from scratch, rebuild the relationship with food, and again, arm yourself with some knowledge about how to eat properly, how to achieve your proper nutritional goals. We want all of our patients to be eating a well-balanced, natural diet. We want them to have whole foods, naturally occurring foods, unprocessed foods, in small portions that have a high nutritional content. We want to stay away from processed foods, away from simple sugars and carbohydrates, and focus on high protein, healthy foods. Having access to good nutrition is central to success in general in life, but especially when you're treating obesity. And surgery coupled with a proper diet, and then of course exercise on top of that, allows patients to eat the foods they want to eat once they've rebuilt their diet. Eat them in the proper portions and feel satisfied, feel a decrease in cravings for certain high calorie and high carbohydrate foods. And as a result, overall, lipid profiles, blood pressure, sleep apnea, fatty liver disease, and obviously obesity itself, the weight side of things, improves. Body composition improves, muscle mass improves, bone density stabilizes when patients are doing the proper recommended treatment strategies.
And then other things I often hear kind of piggybacking on that is, I don't want to lose too much weight. I don't want to be too skinny. And they have these visions of people from having gastric bypasses or other procedures 20, 30 years ago where they appear gaunt and not kind of a remnant of their former self. And that's really not the case these days. Rarely, almost actually, I haven't seen a patient in 6 years of this practice that lost too much weight, where they became unhealthy, where they required a different surgical intervention, where they required supplementation. In fact, that your body adjusts and is happy with its new set point, and it finds a place, a new home for itself, for your weight. Going along with being afraid of losing too much weight is afraid of losing my hair and things like that. And we found that if you rapidly increase your protein intake and your hydration and your calories in the first month, the risk of hair thinning is very minor. But it takes work, like we said in the beginning. It takes effort using the protein shakes as a crutch in that first month or two until you're reliably getting the amount of protein you get from your guidelines from the nutritionist and from us.
Another key point for our patients to understand is that you're not alone in this. We're here to help you through this process. And I think that, Dr. Kudov mentioned that we're rebuilding your diet, and we don't expect you to know everything. We don't expect you to do that all on your own. We work closely with dietitians, nutritionists to give you the information you need, and we reevaluate at every step along the way, how can we better improve your nutrition? How can we get you to a point when you're following a diet that's going to be the best for you to lose weight, the best for your health.
Which is why we want to see you all the time. We want to see you at 1 week, at 1 month, every 3 months for the first few years, because everybody's requirements are going to be different. I have a patient who kickboxes and burns 700 calories, and their diet requirements are going to be different than someone who's 60 and losing weight so that she can get her hip replaced, which is going to be different from the young man who's now doing CrossFit and bench pressing 450 pounds. Each one of these people are going to have different protein requirements, carbohydrate requirements, fat requirements, calorie requirements, and working with us and your nutritionist really helps tailor this to, again, we're back to individualized therapy.
And also to what Dr. Antoine said, some patients think, well, I'm going to get the surgery to make me lose weight. And they think that the surgery is actually just going to automatically do something, and then they're just automatically going to lose weight. And that couldn't be further from the truth also. So that's another myth or common misconception. I tell patients the surgery doesn't make you lose weight. It helps open up your potential for successful weight loss with the diet and exercise component added to that.
Of course. And I love your analogy of the three-legged stool.
Yep.
I always tell patients that successful weight loss is like one of those three-legged stools. So one leg is a surgical intervention or a surgical treatment or a medical treatment. Another leg or support, part of the support structure is diet. And another part of the support structure is physical activity. If you only have 2 out of the 3, it doesn't really work as well as if you have all 3 working together.
Excellent. Yep.
Well, talking about what you were speaking on, Dr. Kudov, about patients' misconceptions about not being able to eat again, I think that's furthest from the truth. 1 week after surgery, 1 month after surgery, I have people come in saying that they're very surprised at how they feel. They're able to eat, they're able to drink. It's a very comfortable type of lifestyle. It's not necessarily a diet of deprivation. People have control over their hunger. They're not ruled by their appetite any longer. So I think that's furthest from the truth. It's very interesting to see people come in after surgery saying that they're very surprised at how good they feel, and you can basically have almost everything you want with the idea that maybe there are healthier food items that are available. Sweets on occasion are fine. Carbohydrates on occasion are fine, with the idea that there's probably something else better. So it's a tool like anything else.